Hi everyone, welcome to Talk About Life, and you are tuning in to Talk About Life on YouTube and on podcast. And I'm grateful to have someone from Malaysia, KL, Ben, and Ben will introduce himself to you. But I'm going to run through some of the questions for our listeners and our viewers in a summary. Today, I'm going to talk about three big topics with him. Number one is the MCO, the controlled order in Malaysia. Let him talk about that. I think it's one of the strictest orders in the world. And it did benefit Malaysia at some point in time, for the last 6 months. And I want to talk about the policy to explain and also explain to the world how did it impact on the people. Were the people generally open to this MCO? And were there any upset, disgruntled? Were the people compliant? And that kind of reflect on the society as a whole. And also a second topic on family. And when you're on lockdown with children like yourself and your wife, I just want you to explain to the world the pros and cons, good things and the negative things that has happened between you and your wife, husband and wife. How did you manage being in a very close quarter under one roof when the doors are locked, you have no access to the outside world? How did it affect your relationship, pros and cons? And also with the dynamic of compounding it with children. I really want you to talk about that and share with the world what are some of the learning lessons. And there's a good part of Europe in the second lockdown now. Tell the world some of the tips that you have learned and share with the world some of the good things that have come out that the world can actually learn if certain countries or cities will go into the second lockdown or third lockdown. We don't know. None of us know how this is going to pan out in the world. And the third point I want to talk about is the economic impact. The long lockdown, drawn out period, how it's affecting local economy. I'm talking about companies. I'm also talking about local SMEs and micro enterprises. I really want to know that how this affects people, their lives, the hardships. And I think people should hear whomever is going to be out there, government officials, whatever, who's going to click onto it and tell the people the hardships in general, and also in specific cases that and how it's going to make people's lives a little bit better if the lockdown is going to be prolonged for the next 3 to 6 months. So there's going to be three parts to our conversation, and I'd like to thank Ben for coming on. And Ben is a very seasoned media speaker himself. So let's do it. Ben, tell us about yourself, and then go into the three topics that we would like the world to know.
Sure. And thanks, Vicky, for inviting me. And Vicky, if you don't mind, sometimes when I talk, I get too excited. So you just got to remind me about the points so that I don't go off topic, because I want to be on topic. So the first question is very easy. My name is Ben Ibrahim, even though my Zoom chat says Kyla. Kyla is my daughter. She's obviously been doing Zoom school from my computer. So I keep telling her use her own laptop, which I bought her, but she likes using my big computer. So that's okay. Part of being a dad. I am a father of two children. Kyla is my daughter, who's 8 next year. Kyle is my son, who's 4 next month. Sofia is my wife, who's going to, God willing, will be finishing to she's studying a diploma in childhood education. She'll be qualified end of next month after 2.5-year advanced diploma to teach at primary school. So that's her career journey. About my professional self, I've got a master's in human resource management, graduated from Monash University, Australia. I came back to Malaysia 17 years ago after studies, worked in HR for a little bit, but my true calling was communication, where I wanted to be a journalist, and I wrote for a few magazines and newspapers. Those relationships led me to a TV job, and I just didn't take it seriously at that time. It was a freelance role, but I took it to a very high level in terms of a career high level, and I worked with Fox, the History Channel. So I know a bit about working in Singapore. I used to work in Fusionopolis in Singapore. And yes, because of all those relationships that made me a better presenter, I get invited to be a master of ceremonies or a TV presenter for certain domestic organizations within Malaysia and overseas organizations. But TV presenting jobs and MC jobs are very seasonal. I also brand myself as a part-time academic HR and PR lecturer and also a communications consultant.
That's a good pitch, like a whole paragraph in 1 minute. So tell us about the, let's go into the macro part of our topic, the MCO, which is called the control order, right? The movement control order.
Control order, yeah.
Yeah. Tell us, explain to the world, what is this movement control order? And then tell us then into the lockdown.
Okay. It basically started in March. It started 1 week before Kyla's birthday. I think it started on the 15th of March, and Kyla's birthday was on the 21st of March. So we did have a big celebratory birthday, which we planned. So basically, the numbers were spiking cow, as we say in Singapore and Malaysia. So we don't, at that time, nobody knew why, or the 5 W's and the H, how, why, what, where, when. Everybody kept blaming China, but I think there's in my personal opinion, there's a lot more to it than that, okay? And so the numbers were spiking. Coronavirus was a ghost. You couldn't see it, okay? You couldn't see the symptoms. I mean, if someone had a cough and a cold, they had a cough and a cold. I mean, you're not gonna really touch someone's forehead and see how warm their body is or cold their body is. That's how you measure if someone has got signs of coronavirus. So what the Malaysian government did, and it was a new Malaysian government at that time, is that they say, okay, everybody stay at home. Limit the distancing between people, okay? Which was an unpopular decision at that time, but the right decision at that time. Schools went from face-to-face to Zoom. I work with Malaysian basketball as my day job 4 days a week. We got told to work from home and all our tasks were done from home. And we were doing Zoom meetings like we would be doing day-to-day meetings. A lot more challenging, of course. I mean, before we started this conversation, my 2 children were making noise. I had to politely tell them to go please do their homework in the other room. So it has been challenging, and we'll get to that in a minute. But basically, the MCO became the RMCO, Restricted Movement Control Order, and then became the CMCO. Now, in Malaysia, and I must say, I'm not saying this because whatever, but we Malaysians are not very good at saying what we've done well. We're too humble, okay? Whereas the other countries are fantastic at that. So I always tell my Malaysian friends, let's not mumble. Because if we mumble, we become too humble and nobody knows the great work that we've done. So the Malaysian government and the Ministry of Health Malaysia did a very good job in getting the numbers down, keeping the community safe. And I'm not a political person, I'm not. I used to work for the government, but I have no political inclinations. So they did a very good job. So they did such a great job that the RMCO and the MCO was lifted in late August. So things went back. I went back to work. I work in the events business. A lot more events were happening. So cari makan, or feeding the rice bowl, became less problematic for me. But then, through a certain series of events that happened domestically, the numbers went up again. So the government made an unpopular decision, go back home. CMCO, Movement Control Order. Okay? So I'm back to square one, and I'll be honest with you, that's why I have a little bit more time to talk to you and your wonderful audience. But things happen for a reason. So that's the MCO, CMCO, RMCO here in Malaysia. Basically, you can't go outside. It has improved, but we have taken a few steps backwards in the last 6 weeks.
So can you say at this time you are, in very simple English terms, like a soft lockdown or a strict lockdown?
Well, the lockdown got extended. It got extended until the 6th of December, and that announcement came on the weekend. So the numbers are still a very, very big concern, especially in Sabah. Yes, but Sabah is not in West Malaysia, so you can't drive there. You can only fly there. But I'm originally from Sabah. My father is from Sabah, so we have family there and friends there. So it is a bit of a concern. They're in complete lockdown. They can't go out. If they're going to the supermarket, only one person. Yeah, it's quite rough over there. We feel for all our friends in Sabah because they're very, very positive people and nice people. And I'm not saying that because I'm from there, because they are, generally speaking, Sabah brand themselves as very open people and very relaxed. So it's sad to hear. But yeah, the numbers in certain areas, we call it clusters.
Yeah.
The clusters in certain areas of Kuala Lumpur is high. So they're really, the government is really trying, they believe that if you break the social engagement of people, you will bring down the numbers.
Yeah, break the transmission. So in KL right now, are you allowed to go out, and are the businesses allowed to open?
Okay, certain businesses, like the government was saying no to hairdressers, no to medicine like like sports medicine, like sports massages and stuff like that. You can't do that.
Okay.
Physiotherapy apparently is allowed, but you got to limit the numbers inside. Hospitals, of course, hospitals are always open. Schools are definitely no. All schools in Malaysia, universities. I teach PR every Friday with a small college called Reliance College. I've been doing that on Zoom. I went back to class once, and then
So
after
that
that,
means at this point, all classes are closed. All
Yes.
schools are closed. Wow.
Yes.
I mean, okay. Until August, during that period of the MCO, it was closed, right? The whole of Malaysia was closed. Was it a period that it opened up and people went back to school?
yes, my daughter Kyla went back to school, and she was very excited about it.
Yeah.
She went back to school. I can't remember the date. I think it was sometime in September. So
Okay.
but
So
it
the
was very
schools
strict.
resumed opening September, and then lately it closed again.
Yeah, it closed at the end of at the start of October. Around about that.
Yeah.
So
Yeah.
school academic institutions, a lot of private companies, SMEs are working from home.
Yeah.
You have to have a letter if you're going to work, like a letter from your organization saying you're allowed to be in the office. Yes.
That means when you go out to the streets, there are police that monitor the movement, and then you have to use the letter. Am I right?
To a certain degree, that the police roadblocks were very heavy in March and April and May. But then when people got more aware of how this virus works, people were more respectful of that. What the government has done a very good job is called the My Sejahtera app, is that when you go to a restaurant, when you go to a supermarket, you must take a picture of a barcode, and then they will do your temperature check. So let's just say, God forbid, I know someone who has coronavirus. Through the My Sejahtera app, you can scan where they were. They went to the supermarket in Ampang at 6 o'clock. They went to their office at 8 o'clock. They went to school at 9 o'clock. So in between those three areas, someone in those three areas must have coronavirus. So the Ministry of Health officials will check those three areas and see, is there coronavirus active in those
Specifically,
areas?
right now where you are, it is a soft lockdown for the economy, because the companies are instructed to close. I mean, those that you have physical contact, they're instructed to close. And people like you and your children, the schools are closed, and you are asked to stay home. But is it mandatory?
Because the rule is, okay, you can go to a restaurant, but no more than 2 people. You can go to a supermarket, but only 2 people. I used to be 1. Okay, so my wife and I would toss the coin, who's going to the supermarket to buy Pampers, milk, and veggies and meat. Okay, and yeah, so and the queue to get into the supermarket is massive, especially on the weekends, because you have to line up to scan yourself with the My Sejahtera app, and then only they'll allow about 10 to 15 people inside. Once 10 to 15 people leave, then another 10 to 15 people come in. Okay.
The general feeling about these policies about Malaysia, right? How do people feel? Because it's really controlling your life, right?
Yes.
It has an effect on your mind. And a lot of people going crazy in many parts of the world, right?
Of course.
Because of that. But how do Malaysians in general and the people you know in your community feel about this? Pros and cons.
We're well frustrated, but we respect it because the communication of this has been very good, and I must credit the Ministry of Health, and I must credit the media, the Ministry of Health.
Yeah, tell us in detail, how did they communicate, which is important because you're an MC, you're a communicator.
Yeah.
The same message done differently, people will receive it differently. Tell us, how did they do it that made you feel that, hey, we should respect this?
No, I mean, it's a good question, Vicky. I mean, the Ministry of Health and the media did a very good job. We sent the Director General, Tan Sri Doctor, of the Director General of the Ministry of Health. He's a trained doctor.
Yeah.
I don't know him personally, but he seems like a very nice guy. He would give 3 press conferences a day. Still, like, okay, these are the numbers. This is where the clusters are at. Please avoid these areas. Please stay at home. The hashtag "please stay at home" was like rammed into every Malaysian's head. Okay, in a good way. Okay, so and these press conferences are not just on TV. It's on social media. You know, live stream. So they did. I mean, the communication has been fantastic. WhatsApp is going crazy. WhatsApp can beat any news portal here in Malaysia. In the sense, people are forwarding, sharing, fake news, non-fake news. You know, but everybody is concerned. It is
even now at this time.
Yes. It is the #1 topic that will be probably on top of Malaysia's history list forever, I think, unless something, I mean, you never know the future, right? But hopefully, yeah, it is. I mean, MH360 or, you know, the MAS accidents over the years, that dominated the headlines for a long time. But now we have this, I mean, and then they went quiet and now it's this. So, yeah, people are scared, people are concerned. You know, I really feel, you know how us Asians, we look at academic exams, you know, the SPM exams, the year 11 or Form 5 students who are doing the exam, their exams have been pushed to February next year. You feel for them. That's a major milestone in their life. Like once you graduate from high school, they can't graduate from high school.
So there is a real, how should I say, respect of the order. And I see on YouTube, you know, people are going around, and even those rural countryside areas where, you know, these micro enterprises where people sell food, they're all wearing masks, and even in an open space, they're using the thermometer to test. So I was thinking, wow, this is a community whereby people practice and people respect, and it's a really embedded part and parcel of their lives. Am I right to say that?
No, it's true. It's true. People are scared. People are takut. Takut meaning scared. You know, you can't see the coronavirus. You know, there's a number that's always reported every day. But fortunately, to the health professionals and the Ministry of Health's credit, they've done a fantastic job treating people and bringing the numbers down.
My next question is,
I wish I was a communications consultant for them so I could tell the whole world how good of a job they're doing.
So you can do it through the YouTube. You know, I can do another video on that. Yeah. I hope that, no, but I'm serious, you know, if it's something that you feel that the world can emulate, you should let the world know. Now, I just want to ask, does the fatigue of this thing set in? Has it set in, or it hasn't set in?
Well, if I'm understanding your question correctly, and correct me if I'm wrong, and I do apologize if I got it wrong, but the fatigue is the mental stress and the mental health issues. Now, a lot of people have lost their jobs. The service industry, restaurants, airlines, tourism, education. What else is there? Medical services. I mean, in terms of non-traditional medical services. Sports. I work in the sports industry. A lot of the projects just went, look, I lost a project at the start of the year, okay, which was supposed to be a good part of my bread and butter for this year and for the years to come, you know, and yeah, a lot of people have lost their jobs.
Okay.
The government is trying
before we go into the economic impact, let me talk about the mental impact.
And
fatigue.
I was getting to that,
Okay.
Vicky, in the sense that
Yeah.
people are stressed because they don't have a job.
Okay.
And you gotta, I mean, you know our culture, you gotta put food, I mean, any culture, you gotta put food on the table.
Of course.
That's the KPI of a man. We gotta put food on the table. You know? And
Yeah.
we can't. I mean, everybody's struggling.
Yeah.
Everybody's struggling. And like, it makes me mad when someone says, oh, I cannot have my high-class steak or whatever. I said, come on, man. I mean, that's the least of your problems. People are struggling. People who are drivers, security guards, who have 4 or 5 children, you know? I mean, they're not worried what they eat. They just want to eat.
Yeah. I want to ask also, in addition to what you explained, was there a fatigue, as in there's so much restriction in the order, I'm so fed up, I'm sick of it. I mean, you see the news elsewhere, right? People starting to really like rebel against the restrictions of wearing the mask, social distancing. I'm talking about that measures. It's like, okay, I can't meet my family. I can only go out with 2 person. I don't care. I'm going to have a party in the house. You know, that kind of fatigue, does it set in?
Well, I'm sure everybody's human. Everybody whinges. If we had there's no way to measure how many whinges there were per minute, per day.
Yeah.
Everybody complains. My daughter complains every 20 minutes, sings a song, Corona, Corona, go away, never come back another day. So, I mean, I'm sure everybody has sung that amongst many languages.
Yeah.
But you know what? We Malaysians, we've done a great job in terms of being obedient. I mean, I used to study in Australia, and I can't believe in Melbourne, it's better now, how Melbourne people were so frivolous and disrespectful of wearing a mask, going out, running like this, everything's
everywhere.
okay.
I mean, in many countries, yeah.
I mean, America, not refusing to wear the mask, I mean, freedom of whatever. I mean, you can have freedom of whatever, as long as you're not affecting people. So Malaysia, 10 out of 10 for wearing the mask, complying, and doing a great job. I mean, the people. So people, yes, people complain, no doubt. But we've done a great job there, and that's why the numbers always went down.
Yeah, and that's why I know that this MCO is really effective, because when it came in, there was a big announcement, you know, politically there was a change, there was a quick change, and when a doctor comes in, I think it makes a difference, because there is trust. You trust what the doctor is telling you, the doctor in the house. I think the doctor in the house, as in the doctor who's heading the Ministry of Health, right? And he's giving out the press conferences in a very logical, methodological way, and then telling people like, this is the science behind. So it kind of establishes the trust between the communicator, the message, and the people. And that made it successful. Can I say that?
Yes, I mean, look, before this pandemic, we did not know who the Director General of the Ministry of Health was, or is. Now we do. He's a really, he's a doctor, he's got great credentials, not a politician, and he has said some very unpopular things to the politicians to keep our country safe and sound. You know?
So I think that trust has really established, and that people really trusted. Yeah.
That trust is there, no doubt. And I really, as a media person, when things get a bit safer, I hope to put him in front of the camera and tell the world that he and his people did a great job. And they risked their lives, you know, Vicky.
Yeah.
Going out there with shields and, you know, like those virus movies of Hollywood, you know, it was without the machine guns. You know, they went out there and put their body on the line.
Yeah, because there are 2 types of PPE. One is the COVID PPE, and one is the normal PPE. And the COVID PPE is really like sealed you up, and that's quite tough. And I can see that people, even the people are spraying in the streets, right? like industry. I can see in the videos. I just want to know also now. Let's move on to the next topic. We should really talk about this in one of our videos next time, next round, to really talk about policies, because we can go into it so deep, and also because you being so eloquent, I'm really comfortable with you describing it in detail. I think the world should know the details, not just the headlines, right? It should come from the people from the ground, real people reflecting it, and not just like journalists and the media. Coming from you gives it credibility.